Okay. Nicole is an audiologist. She got her degree from the University of Texas at Dallas, has worked at Stanford Children's Hospital, and she began at the George Washington Speech and Hearing Center in 2018. So she's collaborating with Dr. Auer and others on research projects and outreach. In addition to clinical and research work, she teaches courses in audiology and oral rehabilitation on the campus of George Washington in Washington, D.C. Now, Ed Auer is a cognitive psychologist who studies multisensory speech perception. Throughout his career, he has conducted behavioral and neuroscience research at how do you say that, Ed? At
Gallaudet.
Gallaudet. Thank you. I always wondered. Gallaudet University, the House Ear Institute, and the University of Kansas. He is currently an associate research professor at the George Washington University. He is also a member at See Here, a startup that developed the online research product platform for conducting testing and training. So with that, I will take it, present it over to you, and you can explain what is happening in the recording.
Sure. So thank you very much, Sandy and HLA Los Angeles. It's nice to be back, if only virtually. I spent quite a bit of time working at the House Ear Institute. I'm lived in San Dimas and know the LA area well. Actually, one of my co-authors on this, Dr. Lynn Bernstein, also worked at the House Ear Institute for quite a while. We were there in the same research lab, and now have reconnected back at George Washington and are continuing our collaboration. What we're going to do is I've got a pre-recorded presentation that we'll play through. And in that presentation, there is a point at which halfway through where we can stop for questions. But by all means, feel free to enter your questions into the chat as we go through. I'll be monitoring that, and then we'll open it up at the end for further questions. And Nicole and I will be here to answer your questions, and hopefully I can answer some questions about the project if you have any. So without further ado, what I will do is I'm going to share the video, and let me get that rolling. All right. And I'm going to hit play on this. We are all faculty members at the George Washington University in the Department of Speech, Language, and Hearing Sciences. Our team has collaborated to research multisensory speech communication for several decades. We conduct basic and applied research and develop custom technology for speech communication. Currently, we are translating what we have learned into tools for public use. We have conducted our research at several institutions, including Gallaudet and the House Ear Institute in California. First, we should tell you the answer to the question in our title: can training improve understanding of noisy speech by listeners with hearing loss? The answer is yes, but maybe in a surprising way. Here is a chart showing training results from 13 adults with hearing loss from a recent study. The pink color shows their word recognition before training, and the blue color shows their word recognition after training. Most of these listeners improved their word recognition after training for about 30 minutes in 8 sessions. They did not train on the words that were tested. The top row shows their gains in recognizing words when the words were in high noise and they could also see a video of the person who was talking. The second row shows their results for just listening. You can see that not everyone improved, but a few improved a lot. However, you might be surprised to learn that no one received listening training. Everyone who improved on audiovisual and auditory word recognition were trained only on lip reading. The bottom row shows how these adults did in lip reading before and after training, and almost everyone improved. In other words, the improvements in listening and audiovisual speech recognition and noise were the results of training on lip reading. Our results are good news for training and listening and noise. In contrast, recently published studies of auditory speech recognition training have not been so encouraging. But adults with acquired hearing loss are not usually good lip readers. This gives them lots of room for improvement. And the really good news is that improvements in lip reading can lead to improvements in audiovisual speech recognition when you can see and hear someone. Lip reading a person better can also lead to understanding them better when they cannot be seen. We're now going to tell you some more about lip reading and audiovisual speech recognition, but we thought we should first answer the question in the title of this talk. In today's presentation, we're going to tell you some things about lip reading that you may not have heard before. I will begin by defining what we mean by lip reading. Next, I will discuss how watching the talker can help you hear better in noisy situations. Then I will present some important features of lip reading training, along with why we think it's important to train on lip reading. I will then let you know how you can help us out by participating in our online research studies. Our participants are thanked with a gift card at the end of the study. We will conclude by showing some demonstrations of different training approaches. We will take some breaks along the way for questions. Lip reading is the ability to understand speech by watching a person when they're talking. In the next few slides, I'm going to show you some examples of speech information available on the talker's face. I feel this is important because some people believe that not much is available from the talker's face. When talking about lip reading, we often focus on the shape of the lips. And clearly, the shape of the lips is important for identification of consonants and vowels. In this slide, we show still frames that capture the talker's face at informative points when speaking 4 different English consonant sounds: b, f, s, and th. When speaking, we know that the lips press together to make the B consonant gesture. In contrast, the talker touches the lower lip to the bottom of the upper teeth in order to produce the consonant F. However, when we look at these different consonants, we see that the term lip reading is really a misnomer. It is not just the lip shapes that are important. Skilled lip readers glimpse into the talker's mouth to see their tongue movements along with watching the rest of the talker's face, including their cheeks and their jaw. For example, as you can see at the image on the far right, the talker places the tip of his tongue through his teeth to produce the TH sound, as in thin. In this slide, we see the difference between the vowels as in hut and a as in hay. Both vowels have similar lip shapes, as you can see, but the tongue is in a different position, which can be seen by looking into the mouth. They also differ in the puffiness in the cheeks, which can be seen by looking at the regions around the mouth. You can feel the difference in your own mouth by alternating between and a repeatedly. Those differences that you can feel are also visible and used by the skilled lip reader. In addition to what can be seen in still frames, skilled lip readers use lip, jaw, cheek, and tongue movements to understand speech. Here, I'd like you to focus on lip, jaw, and cheek movement when watching a talker say the syllable da repeatedly. On one side is the full video, and on the other side, we just see the dots that were on the face while he was talking. If we take away the talker's face and just watch the dots move, we can see that he is talking, and we can see that the lips, jaw, and cheeks are moving. For some, this motion can even provide an indication of what he was saying. As you're beginning to see, the talker's face can convey a wealth of speech information. But this raises the question of just how accurately can individuals lip read, and how much do they vary in that ability? We've done some research to investigate that. We have tested the lip reading ability of several hundreds of both deaf and hearing adults. These tests are in the form of watching silent videos of a talker saying a sentence, and then a participant typing in what they thought the talker said. The sentences are common English sentences and are presented without any context. Here we see the results of one such study. The figure displays what is referred to as a box plot, and we use this type of plot because it shows the whole distribution of results in one figure. One feature of both the hearing and deaf participants' performance is just how much variation there is in the lip reading ability. The deaf range between 0 and about 82% words correct. The hearing range from 0 to roughly 65% words correct. Another interesting feature of this figure is that deaf participants tend to be better lip readers than the hearing participants. A main take-home from this graph, in relation to what I've just been saying about lip reading, is that the high levels achieved by the best deaf participants demonstrate just how informative the talking face can be. Furthermore, the relatively low performance of the hearing individuals suggests that for many, there is a lot of room for improvement given appropriate training is given. We now turn our attention to the question of how does lip reading help when listening in noise? We know that for many people it is rare to rely solely on lip reading to understand the talker. Frequently, individuals will be able to see and hear the talker. Importantly, when you watch and listen to a talker, the combination can make for highly intelligible speech. Put simply, the combined information is far greater than the sum of its parts. In considering the benefits of lip reading, we are thinking about how a hearing aid or cochlear implant can work with lip reading to improve communication. Here, I'm using a visual example to explain how listening and looking work together. This first square, filled with colorful noise, represents listening in an extremely noisy environment without a hearing aid or implant. If you look closely, you can make out that there is the word speech in the middle of the box. However, it is quite challenging and you might not even be able to see it. The second square represents listening with the benefit of a hearing aid or implant in that same noisy situation. In the best circumstances, the increase in audibility from the hearing aid and any benefits from directional microphones make it easier to understand speech. However, there is a lot of room to increase the intelligibility and the ease of recognition of speech. The third square represents listening to speech with a hearing aid combined with lip reading. Speech is far easier to understand and it separates from the surrounding noise. You might ask, if you have a really good hearing aid or implant, why is lip reading important? And I'll have the audiologist on our team address these limitations of hearing aids and implants.
Hi, I'm Dr. Nicole Jordan. I'm the clinical coordinator of audiology at the GW Speech and Hearing Center. Let's talk about why speech reading and lip reading is important for those that have hearing aids. Hearing aids have distinct limitations. First off, they're aids. They're designed to aid and help you hear, but a hearing aid is not going to be able to help you hear what a normal hearing individual hears. It does not equate to normal hearing. So hearing aids absolutely have limitations. When audiologists fit your hearing loss prescription, what's unique to you and your ears and your hearing, many times they fit the hearing aids to optimize audibility while still optimizing comfort. In doing so, many times treble tones, high pitches and high frequency sounds are decreased in order to optimize comfort and naturalizations of sounds. In doing this, while they make the hearing aids a lot more comfortable to you, they might decrease clarity to some of the softer, higher pitch sounds like S, TH, SH, P, and F. In terms of the individual, the more hearing loss an individual has, the more difficult it is for an audiologist to be able to maximize that audibility, comfort, and sound naturalization. The softest sounds that you're able to hear are now louder than what they usually are with normal hearing. So in cases of moderately severe, severe, or profound hearing loss, there is a higher risk of not hearing certain speech sounds, or sometimes those speech sounds sounding more distorted than they would if someone were to have natural hearing. Finally, with hearing aids, although technology has come such a long way, the microphone adjustments that are made automatically within the hearing aid and the noise reduction in the hearing aid, the actual processing chip itself, can only do so much. So a lot more needs to be done by the listener in terms of attention, focus, filling in gaps, or in the case of many individuals, filling in those gaps with lip reading and being able to see the speech to better hear the speech. While cochlear implants are amazing technology and help adults with severe to profound hearing loss, and in many cases now have been brought in to help those that have high frequency hearing loss or even single-sided deafness, they also have limitations. While many individuals with cochlear implants have thresholds, or they're able to hear soft sounds consistent with normal hearing, having a CI or cochlear implant does not equate to having normal hearing either. A cochlear implant provides that audibility, but so much more has to be done in terms of brain hearing, listening, and communicating. While individuals that have cochlear implants have more access to those speech sounds than they did when they used a hearing aid, the improvement in terms of noise filters and also directionality with microphones may also not be enough for successful communication when there's lots of background noise present. In situations like that, being able to see the speech really helps an individual in those listening situations. If you have a cochlear implant only in one ear, you're still going to be missing important timing cues and loudness cues that are important for successful hearing and background noise. We are designed to hear with 2 ears and a brain, so if those ears aren't working the way they should be working and even on both sides, sometimes it's going to be really difficult to hear in noisy situations. In these cases, being able to see the speech rather than just hear it makes a big difference. So if you're a hearing aid user or you're a cochlear implant user, how much of a benefit can you get from lip reading? The noise suppression of hearing aids and cochlear implants, again, has come such a long way, but is still less effective than what your eyes can provide you in terms of being able to see the speech. In this first option, you can see that the speech is still fairly faded. You can see the word speech, but it's not clear. This is a great visual of how those noise suppressions and hearing devices can help you hear a little bit better in background noise, but aren't perfect. The big clarity comes from being able to see that speech while using your hearing devices at the same time. You can see in the second option, you're getting much more clear speech reading. In terms of the difference, digital noise reduction is able to increase your ability to hear by 3 to 5 decibels, whereas when you add the lip reading in, it increases it significantly more, up to 12 to 20 decibels. How might this help you improve speech understanding and background noise? I love this graph here. This is what we call the speech banana. What it is a superimposed picture of where speech sounds lie over an audiogram. So we've got low pitches here all the way up to high pitches. And the further down the graph you can get, the more hearing loss exists. Some of the softer, higher pitch sounds or treble sounds are going to be here with the F, TH, S. Some softer sounds like P and K are also going to be difficult to hear for those that might have high frequency hearing loss. When you add background noise, that background noise tends to be so much more powerful than the soft, high-pitched speech sounds. In audiology, we often say that low pitches, which equates to background noise, provides the power in speech, whereas some of the high-pitched sounds or treble sounds add more clarity. So if you've got a lot of power and background noise that is making it difficult to hear the clarity, you're really not going to understand the message very well at all. So again, in most situations, even with normal hearing individuals, when background noise is present, those higher pitch sounds like F, TH, and S may be hard to distinguish by ear.
Thank you, Dr. Jordan. So as we saw earlier, by examining the tongue, teeth, and lips in these still images, it's easy to see the difference between fa, fa, and sa. So even though these differences are hard to hear, they're actually pretty easy to see. This distinctiveness is even easier to see when we watch the video of the talker saying fa, fa, and sa. We start with the full face, full speed video, and then focus in on the mouth region, slowed to half speed for demonstration purposes. Our brains are designed to combine listening and lip reading to make speech more understandable in noise. To give you a feel for how much you might already benefit from viewing the talker, we will do a little demonstration. We will play a single sentence spoken by a female talker, but to make it more challenging, the sentence will be mixed together with some background babble. I will play the example twice to give you a chance to listen to it and try and understand what she is saying. Although the talker's face is shown on the screen, it will not move. Is everybody ready to listen and try to understand the sentence? Here we go.
$5
And one more time.
$5
Okay, that was pretty challenging. So let's go on and we'll try to see what we can do when we can see the talker's face moving. Now I will play the exact same audio clip, except this time you'll also see the talker's face move as she speaks the sentence. Is everybody ready to listen and watch? Here we go. Okay, I'll play it one more time. The talker said, "Do you have change for a $5 bill?" Hopefully this demonstration gives you a feel for how much easier it is to understand speech when you can also see the talker. But if watching didn't help, it may be that you need to improve your lip reading, because better lip readers can do this task better than poor lip readers. Okay, I'll just pause for a second here. If anybody has any questions, feel free to type into the chat or you can ask. Okay, yes.
Ed, I do have one question.
Yes.
If you're in a noisy situation and you are trying to lip read, it sounds like when it's noisy, you can hear the lower frequency sounds. So would it help just to focus on looking for those S's and THs and then use that as a clue to what the rest is being said, rather than trying to follow everything that the person's lip reading and saying, because sometimes that can be pretty tiring, just trying to see them and focus on that.
Right. I think the best thing, from my perspective, the best thing to do is to try to understand as much as you can through lip reading, and let the natural process of combining that information take place. So rather than trying to say pick phonemes that you're looking for, speech sounds that you're looking for, that may actually impede your ability to understand speech. So what I was trying to do with the demonstration there is really to highlight that there is complementary information, but the way in which you perceive that information in a conversation really needs to be a fairly natural process. Otherwise, you can get bogged down in trying to look for those sorts of things. And I think it will come up in a second in the discussion of what we need to do to train lip reading for these types of situations. That we want you to focus on learning to lip read a little bit better and just pull more information out overall so that you can combine it with the audio. There's another question that is about where we can receive lip reading training. At the end of this presentation, we are currently testing several different approaches to lip reading training that are all focused on improving your lip reading performance. And you can certainly volunteer for one of those studies. There are also other online programs that have been developed to help you learn to lip read. There's also a question about lip reading being a moot point with a mask. That is true, although there are clear masks if you can get people to wear them, that does allow you to be able to lip read with a mask on. But hopefully we're getting to the point where we won't need masks as much anymore, and we can get back to having the full information available to us. One interesting thing that I've definitely been hearing from some of our participants is that having to converse with people with masks has highlighted to them how much they were using the visual information before, that they're really having a difficult time because of the masks. Okay, so I also see that we have somebody with a raised hand. If you'd like to click in, and maybe Tim, you can help out with this. They can either type their question or they can just ask.
I think it was Diane.
Yeah, it was
Diane,
me.
go ahead.
Yeah, it's hard for me to type because I also have a visual impairment. Which,
Gotcha. That's fine.
Will be another question. I wanted to ask a question about that last video you showed with the woman talking.
Yes.
It seemed to me, two things. It seemed to me that the voice was not in sync with her face when she was talking. It seemed what I was hearing and what I was seeing were like she started talking and then the video of her mouth came in. So it just seemed a little out of sync to me. And the other
I wouldn't
thing,
be surprised by that.
okay.
The video sharing through Zoom has caused us some problems in that sort of synchrony. In our studies, we make sure that everything is downloaded to your computer so it's synchronized. But it's been an issue. I've played around trying to get it to work better, but thank you for pointing that out. And you had a second question.
Oh, the other thing was just an observation. Some of you may have heard me mention this. I've been reading an old mystery from the 1940s called The Listening Eye by Patricia Wentworth. And at the beginning of the book, it starts out in a museum and a woman who has lost her hearing due to the Blitz in London. She's in a museum, and from across the room, she lip reads two men planning a murder. Now, this takes place 2 years after she lost her hearing, and she is an excellent lip reader because when she explains it to somebody later on, she got every word perfectly. And it just drove me batty reading that. I was sort of, well, I won't give away the story, but it was, like, okay, sure, why not? I know it's a plot point, but it's not true.
Yeah, no, Becoming a expert lip reader is a long-term process. Through the training that we're doing currently, we don't expect you to become an expert lip reader. We hope that we can improve your ability to lip read enough that it actually enhances the gain that you get when listening in noise. And we have reason to believe that can happen. The other thing, there was a question about in the video, the background noise began first before her actual speaking began, and that was the case. The babble began first, and then the actual sentence was spoken. Yes, there was another raised hand.
Yeah, Sharon, you want to go ahead with your question?
Yes. So I have a couple things. One, what I noticed personally, my brain like shut down before the noise started. And so I just like, it was almost like I couldn't even attempt to try to discern what she said. I just thought that was interesting. I wear a cochlear implant and a hearing aid, and it was just, I like honed in on the noise, and then I couldn't even, it was almost like I couldn't even see her lips moving. That was one thing. And the second question I had, which I thought was interesting from the speech banana, was like the P and the B, which to me seem similar, and they must not be on the lips, and clearly sound the same to many of us, are in very different areas on that frequency chart. So I thought that was surprising.
Yeah, so let's see. In terms of the P and the B, acoustically, they tend to be quite distinct. So the voicing distinction that marks one of the main differences between a P and a B is usually fairly well indicated regardless of the noise level until you get to extreme noise levels. However, they're very difficult to tell the difference between when lip reading. More typically, what you would see for confusions in noise, in acoustic noise, would be P, T, and K being confused, more so than P, B, and M. There are voicing differences which are fairly loud, and there are timing differences in terms of the articulation between those consonants. So I think in terms of my understanding of the speech banana, that is, well, it's reducing a lot of differences between speech sounds to a very small number of dimensions. And it's somewhat difficult to interpret the differences on that chart. However, there are fairly reliable acoustic differences that, depending on your hearing loss or depending on the noise in the situation, quite frequently P and B are still distinguishable.
Thank you.
Yep. Okay, so why don't we continue, and then we can come back to questions at the end. Another way to look at the benefit of lip reading and listening in noise is to look at some results taken from our ongoing studies. We start with the data from an 80-year-old hearing aid user. We are showing the results for word recognition in sentences. In this activity, sentences are presented one at a time, and the participant types in what they thought was said. All of the audio is presented in combination with noise that is similar to white noise or loud rushing air. Looking at the pink bar, we see this participant is really struggling when listening in noise. He can only hear about 5% of the words correctly. Looking at the blue bar, he's also not a very good lip reader. He is more like the typical hearing participants we showed in the box plot earlier. He can lip read about 13% of the words correctly. However, when he was able to see and hear the talker saying these sentences, his accuracy was greatly improved, going up to 41% words correct. This is a good example of the benefit of being able to see and hear the talker. As you can see, The performance in the listening and lip reading condition is substantially higher than would be expected by adding the listening alone and the lip reading alone performance together. In this figure, we show the performance on the same task for a participant who listens through a cochlear implant. Looking at the pink bar, this individual was doing much better when listening in noise. They were able to recognize 41% of the words correctly. They were also somewhat better at lip reading, but still only recognized 22% of the words correctly when lip reading. Importantly, we see that this participant was much better at understanding speech when they could see and hear the talker. They recognized 65% of the words in sentences correctly when they could both see and hear the talker. Finally, we show here a similar pattern of results holds for a participant with normal hearing. The pink bar shows that they were able to recognize 28% of the words correctly when listening alone. Listening in noise is clearly a challenging task, even for individuals with normal hearing. The blue bar indicates that they were typical hearing lip readers, getting about 19% of the words correct. Looking at the green bar, this participant really benefited from seeing and hearing the talker. They were able to recognize 68% of the words correctly. This level of performance is particularly impressive given that they were not very accurate when they could only look or listen. It's important to note that we purposely make the conditions difficult in our testing. We would expect that if the noise levels were not as challenging, then these participants would have easily reached close to or equal to 100% words correct when able to see and hear the talker. To sum up so far, we have seen that lip reading contributes to distinguishing the consonants and vowels and that this helps us to recognize spoken words. Lip reading can improve our ability to understand speech beyond using a hearing aid and/or cochlear implant. Lip reading can greatly improve understanding speech when hearing speech is difficult in noisy social settings. As we turn to the discussion of training to improve your lip reading ability, an important question to ask is, what is it that makes a good lip reader? The answer to this question is a key message that you should take away from today's presentation. The answer that we've arrived at after years of research studying expert lip readers is that they have the ability to recognize a large number of words without knowing the context. So the key is good lip-read word recognition. We know that this is not an easy task to achieve, and getting better will take some time and effort on your part. We also are not discounting the importance of context. Of course, context is important, but to get really good at lip reading, you have to have fast and accurate word recognition skill based on watching the talker. Think about recognizing words when you're listening in a good setting. You're not thinking about the consonants and vowels and how they match the sounds that you're hearing. You're just hearing the words. Skilled lip readers aren't thinking about the mouth shapes and tongue positions. They're just seeing the words. We don't expect you to become an expert lip reader with this training. However, we know that the better you are at lip reading, the larger the benefit you get when watching and listening. The research shows that poor lip readers get less benefit than better lip readers when speech is noisy. Even small improvements in lip reading will result in a benefit to you. So how do we get there? Even though most adults who grew up with normal hearing are not particularly good at lip reading, our evidence suggests that most adults do have some ability to lip read. In examining our participants' responses, we frequently encounter evidence that even our less skilled participants are perceiving the information on the talker's face, but they're struggling to recognize words using that information. Oftentimes, this comes in the form of humorous responses. In this example, the talker said, "Proofread your final results." Our participant responded with, "Blue fish are funny." While this may seem nonsensical and unrelated at first, on closer examination, this response is quite reasonable. The visible production of proof is well matched with the response of blue fish. The production of final is well matched with the response of funny. So this type of response provides evidence that the participant was responding to what they saw the talker produce, even though they actually responded with no correct words. This suggests that what they need is feedback on their errors. Before we describe what successful training should look like, we begin by discussing what it shouldn't look like. What does unsuccessful training do? It makes you good at naming consonants and vowels in isolation, but no better at comprehending words alone or in sentences. Learning to lip read is not about learning to explicitly match the talker's gestures to the names of the consonants and vowels. This is not what skilled lip readers do, and furthermore, it's not what we do when we are listening to speech. Unsuccessful training also will improve your lip reading of only the materials that you train with. This type of training at best is tuning you to the materials you train on and does not extend beyond those materials. This does not lead to real-world benefits. Unsuccessful training overemphasizes guessing. While guessing can have a role to play, the primary emphasis should be to decode what the talker is saying in the context of word recognition. Unsuccessful training also overemphasizes the reliance on using context. While context is important, what the talker is saying is where the information is. Understanding some of their words can greatly increase the context that you have. So what characteristics does useful training have? It improves lip reading words and talkers that are different from the training materials, so it generalizes. It corrects vowel and consonant errors. So training should provide feedback for more than what you correctly recognize. The brain makes use of the feedback on errors to correct performance. If the feedback is only for what you correctly perceive, the brain does not have what it needs to improve and learn. Think about learning any difficult skill. It's nice to know when you get things right, but where you really need the feedback is where you're having a hard time and you're struggling the most. Finally, it improves audio-visual speech recognition and noise, so it makes it easier when you're listening and looking at the same time. We have developed a variety of training protocols based on our laboratory research and the research of others. We have observed 10 to 20 percentage point increases in word recognition with roughly 5 to 6 hours of training spread over roughly 10 sessions. In part, thanks to COVID, we are now testing these training protocols to measure their strengths and weaknesses when delivered via the web. Our system uses sophisticated software to analyze the errors that are made during lip reading and to provide useful feedback to practice and improve word recognition skills. In a moment, we will be demonstrating 3 of our training protocols that we are testing. Each of those demo videos lasts about 2 minutes, and afterwards we'll open it up for questions that you might have. Before we do that, we could really use your help by participating in our research studies. These studies are completely remote, and there's no need to come into the lab. We're currently seeking individuals between 18 and 85 with and without hearing loss. You must have primarily heard spoken English during the first 10 years of your life, have not had major concussions or other brain injuries, have normal or corrected to normal vision. If you're interested in participating, or you know somebody who might be, please have them contact us by going to seehere.us, which is our research portal. You can also email me at ehour@gwu.edu. Now we turn on to the demos. This first video shows a training approach that focuses on word recognition in isolation. This is a how-to video for lip reading training. It shows all of the activities you will do with every training word. You will be training with 60 real words in each session, and the words will vary in difficulty. Each word will be introduced by a target consonant or consonants. And to begin the training, you will click on that consonant. You will then see 2 words spoken, and you must pick the word containing the target consonant. Select 1 for the first word or 2 for the second word. If you're correct, you will then lip read the word and type in what you think it is. Let's try an example. The target consonant is K. I'll click on the K and then watch the videos. I think the target consonant's in the second word, so I press the second button, and I'm right. Now I watch the word again to identify it. I think it's lake. So I type in lake, and I'm right. Okay, let's try another one. Now the target's G. I think it's in the second word, and I'm wrong. So let's try it again with G. I'll try the second word again, and I'm right. Now to identify it. I think it's wagging. I was close, but not quite correct, so I get to see the consonants and try again. This time I type in wagon, and it looks like I'm right, so now I can go on. You'll do this activity for 60 words in each session. The second video shows a training approach that focuses on word recognition in sentences. This is a how-to video for lip reading training. It demonstrates the sentence training activity. In this activity, a talker will speak unrelated standard English sentences, and you will try to lip read those sentences. For each video, you will watch the sentence and then type in what you thought was said. The software will score your response and then display the words that you lip read correctly. It will also display the consonants in words that were close. Correct words are printed on green, and correct consonants that were in close words are printed on amber. You will then have a second chance to lip read the sentence and type in your response. The software will again score your response and display how you did. The software will also print the correct answer and show you the video one more time. During this activity, please focus on the lower part of the talker's face. Also, please type words or parts of words that you think may be correct. The software needs your response to provide you with feedback. Let's try an example by pressing the button. I thought he said that was cool last night, so that's what I'll type in. That and last were close, so I only get to see the consonants. Cool and night were correct, so they're in green. With that feedback in mind, let's watch again and see if we can do a little bit better. It gets cool at night. And that's correct. Now we get to see the sentence typed out and watch the video one more time. This is how the activity will go for the rest of the sentences in today's session. The third video also shows a training approach that focuses on word recognition, but now we're using nonsense words like yachted, and we're emphasizing visual memory. This is a how-to video for lip reading training. It shows all of the activities you will do with every training word. Look at the printed letters. Every word has 2 Ds and 1 other consonant. The vowels are always ah and I, and they are never printed. Here's an example. Look at the printed letters and say the word yachted to yourself. Remember yachted while we work through this example. I will click on yachted to start the activities. My goal is always to match the first video word to either the second or third video. Now, I have to decide whether the second or third word matches the first word yachted. I chose word 2. I was wrong. So I get to try one more time. I have to pay attention because the correct word may be word 2 or word 3 on this second try. Look at the printed letters and say yachted to yourself. Remember yachted. I think the matching word is word 2. Now I'm correct. Lastly, a different talker will say a word, and I will have to decide if she said yachted. I think it was the same, so I will click on same. Looks like I was correct. Let's go through one more example. This time the word is doshed. I thought it was 2, and I was correct. I thought it was the same, and I was correct. You will do this activity with 80 different nonsense words in each training session. To recap, lip reading is important because it compensates for hearing difficulties in noise and in quiet. The better a lip reader you are, the more lip reading can benefit you, whether speech is in quiet or in noise. Training can improve lip reading, but not all methods work. The training needs to give you feedback to help you improve your perception of consonants and vowels in the process of spoken word recognition. Before I open it up for questions, I'd just like to acknowledge the National Institutes of Health for supporting our research. Thank you for your attention.
The captioner's not hearing you, Ed.
I had my mic muted. Okay, so that was a test of how good a lip reader you are, I guess. So the question I was answering was one that came up in the chat while we were watching the end of that video, and it was about testing with an audiogram and whether it would change if there was visual information present. For the audiogram specifically, it's testing very low level capabilities with tones. And so that would not be affected by the visual information, and you wouldn't want it to be. That's a test of how well your ear is transferring the information. But if you were to be testing speech and noise, absolutely the results would end up being different. And what you need is a test that would include visual information during the speech and noise testing. However, those types of tests are not available right now. So it really depends on what it is that the audiologist is trying to get out of the testing. If they're trying to look at your low-level ear function, then you really don't want the vision information in there. But if you're trying to assess how well you can communicate in different settings, then absolutely you'd like to know how well you can do with and without the face.
Ed, can you hear me okay? Am I coming through?
You are coming through. It's not real loud.
Sorry.
Nicole is trying to respond, so I can let her try.
And the captioner can grab me if I'm too soft for some people. I apologize. So this is a great question. With the audiogram, the goal when we're testing those different pitches is to determine what the softest sound you're able to hear. And this is really important just from a diagnostic purpose when we're diagnosing you with the severity and type of hearing loss, and if we're working with you with any sort of amplification, whether that be hearing aids, cochlear implants, bone anchored hearing devices, that sort of thing, or that type of management. But it is also really important in audiology that we do test speech understanding, because that looks at more of a brain cognition type of thing. And why this study that we're working on is so important is not only because we do want to provide lip reading training to people that's accurate and successful, but also because in a perfect world, we would really like to see this lead to some sort of testing that does look at holistically speech understanding with visual input, without visual input, in quiet and in background noise, so that when we talk about management options with our patients, we have a better idea of where they struggle. We can break it down, we can provide them with the information they need to be successful communicators. It's sort of like when you go to the doctor's office and they take blood and they send it off to a lab. That doctor gets all this information about your blood to help you with your health management. We would like to see something similar with speech testing. And right now, like Dr. Auer mentioned, it doesn't exist. So potentially these are the first steps into developing something like that for testing.
So there was another question about qualifying somebody who is lifelong deaf and read lips, but would like to improve. The testing itself is the actual experiment portion of the research is has been set up based on what was proposed to NIH, and that sets certain limits on who we can and can't test in the study. That said, if you're interested in trying out the training itself and not participating in the study, please do contact me. It's certainly a possibility that we can let you run through some sessions, and we'd love to hear your feedback on it. And I did include in the chat the link to seehere.us study. On that link, you can get some more information. You can look at the consent forms that are for the two different studies. And you can also alternatively just email me directly at eauer@gwu.edu. And I'll be glad to get back with you and discuss any questions you might have. Other questions? So there's a question about being able to take breaks during the 80-word session. So yes, it is possible to take breaks. You can take short breaks during the session without logging out. If it was getting to the point where it was too taxing during the study to complete an 80-word session, then it is possible to log out and log back in and have it pick up where it was doing the training. So another question, it seems like better lip reading would lead to less fatigue. That's certainly the hope. So we know that lip reading by itself is exhausting, and we also know that listening in noise is exhausting. The hope is that the training, by getting better at lip reading, it will be less tiresome to pull out the information. That should be the case, although that's not something that we're explicitly testing in the current study format. It certainly is an option for future studies to look at that fatigue factor, if you will. Other questions?
I have one, Ed.
Yes.
I am, as everybody in the LA chapter knows, I am latent deaf. I went completely deaf 2 years ago. I started from radiation treatment that I had 12 years ago for nasopharyngeal cancer. I started to have a hearing loss. It's 7 years ago now. 2 years ago, I went completely deaf. I have two, and maybe Nicole would be able to answer this too. I have 2 cochlear implants. One works, one does not. I have to go see my ear surgeon, Dr. Volker, to try and redo this. My question is, and maybe Nicole can answer, I could possibly, seeing that I am hearing, I'm latent deaf, I have one cochlear, but because of my radiation treatment, it blew out my vestibular system. So I have perpetual vertigo, like I'm dizzy all of the time. And with somebody had mentioned fatigued with the 80 words, sometimes I don't have brain injury per se, but it's sometimes it can be a little much. Like when I take my ASL class, sometimes I get such a brain fog, but I have 95% word comprehension in just the one.
Mhm.
So would I still be able to qualify having this like vertigo, constant vertigo?
Right. That's something that for qualifying for the study, we would have to discuss that amongst the investigators,
The
whether you would
NIH.
qualify for, yeah. But qualifying to do the training, that's a different issue.
Yeah,
And
if it's
perhaps
from,
Nicole would.
I can pop in. If it's from a vestibular thing, which it sounds like it is, that's more
I
an
don't have a
internal.
vestibular system at all. It's gone.
So that would be what's causing the dizziness then. So it's not like you mentioned, it's not a brain thing. So as long as there's no brain trauma or head trauma, I mean, it would really just be a question, Ed, I think, on the radiation treatment and if that had any negative effects elsewhere in the central nervous system.
Right, correct. And I can tell you that we are running some individuals with cochlear implants, and it's sort of a case by case analysis. So we can discuss that offline if you want, to see whether you would qualify.
Okay. Yeah, I just like it. I do pretty well being a latent deaf person reading lips, but it's also like I had hearing for 46 years.
Yeah.
So
Yep.
it's easier for me to understand words
Yep.
only because like
Absolutely. Yeah, you've got the context. Yeah.
but I don't know if because of the radiation totally taking my whole vestibular system, I had training. Like
Right.
I've had vestibular testing, and then I don't
Right.
have one now. So
Right. Right. Okay. Well, it's something that we can talk about offline. Absolutely.
okay, I can
So
email you.
just send me an email and we'll get back to you about that.
Okay, thank you.
Other questions? Okay. Well, I can hand it back to you guys in Los Angeles if you'd like.
Thank you so much, Ed. Thank you, Nicole. This was extremely informative and very encouraging, and I hope that you get a lot of signups from this. Okay.
That would be great. Yeah, we'd appreciate
Okay.
it. And thank
All
you very
right.
much for making this possible.
Absolutely. Thank you for the work you're doing. Really, really, it's so appreciated by our hearing loss community. And I wish you all the best with it.
Well, thank you very much.
You're
And
welcome.
hopefully it comes out well and we can benefit some people.
Absolutely. Absolutely. So right now we're